Good morning. I am Dr. Sreekanth Appasani, Medical Gastroenterologist, Advanced Therapeutic Endoscopist, KIMS Hospital, Secunderabad. Today I will be discussing about viral hepatitis and the precautions which medical professionals need to take about them. I will be talking mainly about hepatitis B and C. We as medical professionals have got numerous procedures, numerous interventions which have come up in the recent era helping patients, and we need to make sure that our procedures and our processes do not infect the other patients also. Of late, every patient who is undergoing any procedure in the hospital has been planned to be checked for routine viral infections like hepatitis and HIV. Some of the places I still do find that they are not being adequately checked for all the viruses. HIV has become very famous, so everybody is checking for the HIV. Hepatitis B, because it has got a vaccine and some amount of media penetration is there, so hepatitis B is also being checked partly. But the third thing which is very important and being missed out is the hepatitis C. It has not got a vaccine and it has got a potential for transmission also, so it also needs to be checked for. So I would recommend to all healthcare professionals before undertaking any procedure that these three viral markers, HIV, hepatitis B with the help of HBsAg surface antigen, and HCV with the help of anti-HCV antibodies, to be checked for all patients before undergoing any procedure. I do accept that there is still a small risk if the patient is still in the incubation period, but that risk is too small. If we adequately screen the patients, one, the chance of cross-contamination of the other patients is also avoided, and more importantly, we are picking up the patients in the early stage so that we can treat them or properly counsel them and get them as well as their family members from getting contracted with the disease or progressing to a final liver failure. So these procedures can be simple procedures like a DNC. It can be simple procedures like a tubectomy, or it can be procedures like endoscopy, colonoscopy, angiogram, bronchoscopy. So I would say any procedure where a particular part is penetrating the body. It may be simple endoscope, or it may be an colposcopy, it may be hysteroscopy, or anything where some foreign body is entering the human body and then coming back. Probably that patient needs to be adequately screened. So all medical practitioners should be making it a habit to check for HIV, HBsAg and anti-HCV for all patients so that we prevent cross-contamination and help in treating the patients in the early stage. I do agree that we all need to take universal precautions, but in a cost-constrained country like India, many places do not follow all the universal precautions because it becomes costly and it becomes a financial burden for the patients. So especially in such places, if we can adopt these modalities of checking for HIV, hepatitis B and hepatitis C, we can prevent a lot of cross contamination, also catch up patients in the early stage.